want to welcome you to today's meeting of the subcommittee. As always, we'll go around I'll go around my Brady Bunch screen here and have everyone introduce themselves. I know we do have some new faces as well as some familiar faces from the past. We thank you all for being here. So I will start with you, Mr. Clark.
Thank you, Mr. Chair. Andrew Clark from the IMRP at CCSU, and we're supporting the task force.
Okay, thank you. All right, and good morning, Chief Drum.
Good morning, everybody. Jack from Madison, Connecticut Police Department, Chief of Police.
All right. Thank you, Chief. And good morning, Mr. Masback. Nice to meet you.
Morning. Nice to meet each of you. Skip Masback. I serve on Pastor Keith King's Reimagining Police Subcommittee of the Connecticut Bar Association's Task Force on Police Reform.
All right. Thank you for being here. And good morning, Ms. Scully.
Hi, good morning, Jonathan. Nice to see you again. I'm Annie Scully. I work at United Way of Connecticut. Excited to be here.
All right. Thank you. And good morning, Dr. Peterson.
Good morning, Chair Slift. I'm Megan Peterson with the IMRP. Good to see everybody.
All right, thank you. And good morning again, Ms. Tepper Bates. Thank you for being here.
Hi, John. Hi, Andrew. Thank you for having both Annie and me. And I am President and CEO of United Way of Connecticut.
Terrific. All right. And good morning, Ms. Knopf. Nice to see you.
Good morning. Nice to see you as well. I'm Gretchen Knopf. I'm the Acting Director of the Department of Services for Persons with Disabilities for the City of New Haven.
All right, thank you. And good morning, Sarah. I know we have Sarah is the ASL interpreter this morning. Good morning, Sarah. Right. And good morning, Ms. Castellato.
Good morning. I'm Maggie Castanado. I'm a Senior Assistant Public Defender, and I am on the Policing Task Force Reimagining Policing Committee.
Okay, thank you for being here. Apologies for mispronouncing your last name.
Nope, you said it right.
All right, and good morning, Mr. Camacho. Nice to see you again.
Hi, good morning, everyone. George Camacho, Policing Law and Policy Director at the Justice Collaboratory at Yale Law School.
Okay, thank you. And good morning, Mr. Alphonse. I see you on the screen twice this morning.
Good morning, Henry Mendoza with IMRP and CCSU.
All right, thank you. And I see someone named Pat. So good morning, Pat. If you'd like to introduce yourself.
Sure, Pat Cooney, an attorney at Fury, Donovan, Tracy, and Daly in Bristol. I'm also on the CBA Reimagining Committee with Skip and Maggie.
Oh, terrific. Thank you for being
among
here.
others.
All right. And good morning, Ms. Ozick.
Good morning, Kenzie Ozick with CCSU and IMRP.
All right. Terrific. And I do see that Mr. Cheggy has joined us this morning. Good morning, Mr. Cheggy.
Yes, hi, good morning. My name is Alvin Cheggy, and I am here as a human service advocate. I work with the Department of Aging and Disability Services, and I am a representative for the deafblind and hard of hearing communities statewide in Connecticut.
All right, terrific. And with your arrival, Mr. Cheggy, you've provided us with a quorum this morning, so thank you. The next item on the agenda is the review of the meeting minutes from the June 15th meeting that was sent out in the invite to this morning's meeting. So for those members that have had a chance to review it, if anyone would like to make a motion to approve or amend is appropriate.
I'll make a motion to approve.
Okay, motion to approve is on the floor. Is there a second? Okay, there's a second by Ms. Knopf. All those in favor? Okay, any opposed? All right, the motion passes. So the next agenda item is an update on the social worker recommendation reports. And with that, we will turn it over to Dr. Peterson.
Oh, yes, thank you, Chair Slifka. Good morning again, everyone. As you are aware, the focus of the subcommittee is improving police interactions with the disability community in Connecticut. So how do we think about A, what constitutes improvement, and B, how do we implement that improvement? One way for improving police interactions with the disability community under consideration is the role of social workers. The proposition is that integrating social workers in police responses to crisis calls made by individuals with disabilities, whether those crises are originating from a behavioral, developmental, intellectual, or physical disability, the idea is that the role of social workers will improve the initial response as well as post-crisis follow-up and attention. Police departments, as well as the Connecticut State Police, so you have your local and then the CSP, submitted social worker feasibility reports to the Connecticut Police Officer Standards and Training Council, POST, as required via amendment passed to an existing public act during last summer's special legislative session, 2020. The requirement of these reports was designed to assist in evaluating the practicality of deploying social workers to crisis calls. In our review thus far, we've identified, and we continue to identify in our review, but we've identified 3 categories across these reports. The first batch includes departments that indicate yes, in fact, social workers are feasible, either because these departments have such a program in place or are piloting such a program, have the budget adequate to hiring a social worker or social workers. So they have the conditions on the ground to either have the program or begin one. In general, these assessments correspond to larger localities, so bigger populations, and/or localities with police departments whose personnel staffing and budget resources permit favorable elements for the additional hiring of social workers. The second batch constitutes departments that indicate no, at this time, social worker feasibility is not possible. This is specifically due to low crisis call volume or safety considerations or budgetary constraints, and that the training of officers at this time is sufficient. So it could be one of those reasons or a combination of those rationales. These evaluations typically correspond to smaller localities and/or localities with police departments whose personnel staffing and budget resources at this time are not sufficient for the additional hiring, of social workers. Then we have this third grouping of departments that I like to call the maybe or the perhaps. It's a combination of yes and no. Yes to the proposition, the concept of overall feasibility, but no to implementation at this time. Again, to those consistent reasonings or rationales, budgetary constraints, fiscal uncertainty, police officer vacancies. They're having a hard time hiring police officers to fill current positions. In addition, loss of police officer positions, safety considerations. And then one other factor that I've noted is more research and study needed. So in some of these reports, the police chief or whoever is writing the report will say, we are interested, but more research and study is needed. And in this final grouping of reports, we see a variety of locality and police department size. So for example, you have the larger municipal departments, which are dealing with police officer vacancies, budgetary constraints, fiscal uncertainty, and/or local departments which are interested in the hiring of social workers, but they don't have the crisis call volume maybe at this time that would warrant the hiring. So that's what we've seen thus far in our review. That's your update.
Okay, thank you. Are there any questions for Dr. Peterson, given the updates? Ms. Knopf, if you were speaking, I think you might have been speaking, but you're on mute.
Yeah, I was just saying to myself, I thought that was a pretty clear report.
Oh, okay. All right, if there are no questions, we will move on to the next agenda item. We have members of the Connecticut Bar Association Policing Task Force that are here with us this morning to provide us some information on some recommendations that they have developed that may be appropriate with our work. I also see that we've been joined by someone else as well. Mr. Keith King has joined us this morning. Good morning, Mr. King. If you'd like to very quickly introduce yourself to the group this morning.
Good morning, everyone. My name is Keith King. I am also a criminal attorney, but I have been serving primarily for the last 17 years as the senior pastor of Christian Tabernacle Baptist Church. I am chairing the Reimagining Subcommittee of the Connecticut Bar Association Task Force, and glad to be with you this morning.
Thank you for joining us. We appreciate it. So with that, I'm going to turn the floor over to that group to speak to us on the recommendations that they've come up with. Again, that are appropriate to our work, and those recommendations were provided to you all in the meeting request for this morning, the meeting invite. So I will turn it over to you. Whoever from the group wants to step up.
And
Esther,
Mr. Chair, if you'll permit me.
Yes, Mr. Clark, of course.
Sorry to interject real quickly.
Nope, not at all.
But I did want to, for folks that might be watching on CTN, under our meetings for the task force website, ctpolicetransparency.com, you can go to the Improving Interactions with the Disability Committee, and those recommendations, as well as all the documents, are currently on the site. So.
Thank you, Mr. Clark. Okay, I will again turn the floor over to the folks from the Reimagining Police Task Force.
Skip, you want to lead the conversation?
Sure. Good morning. I'm going to begin with the almost incomprehensibly difficult task for a 70-year-old of sharing a screen, so bear with me. Against all odds, have I succeeded?
Better than most.
Good morning. The Reimagining Police Subcommittee began with some substantial research into the history of police reform commissions and investigations and legislation that goes back at least as far as the Wickersham Committee back around 1930 and continues with the Katzenbach Report in 1997, the Kerner Commission Report in 1968, and the Obama Police for the 21st Century report in 2016. What's striking about those reports is that for 80 or 90 years, the diagnosis in every report about the difficulties in policing and lethal interactions with civilians, and particularly people of color, are exactly the same. There were difficulties deeply ingrained and entrenched that were identified by the Wickersham Report. The same findings were made by the Katzenbach Report. The same findings were made by the Kerner Commission, et cetera. Each of these reports, in turn, over the course of 90 years, made very sensible recommendations that the difficulties with lethal interactions and discrimination against people of color should be addressed by improving hiring, training, supervision, et cetera. But the takeaway that we had from this steady state of challenge and difficulty is that ultimately, while we should always engage in each of these ways to try to ameliorate the problem and change the nature of policing in America, at some point one has to understand that if one recruits folks into the very difficult job of suppressing violence and suppressing crime, these may not be the right people to be sending out when someone is slumped in a doorway because they're struggling with mental illness or homelessness or substance abuse or any of the others. Net, the inquiry began, how can we find ways in which the behavioral crises that the country is facing cannot be put on the police shoulders, but what percentage of them can be reallocated to professionals in the fields of caring for people who are in emotional distress. That led to a number of different pilot projects that I'm sure you're well familiar with. the crisis intervention team model and the way it has evolved, beginning with its roots in Memphis, the co-responder model and the way it has evolved since its origins in Eugene, Oregon, and everything in between, including the inquiry by the state legislature for the feasibility studies that have just been summarized. While we were developing these models, we had excellent help from George Camacho and the folks at the Yale Law School Justice Collaboratory. And it also led us into research that revealed that actually, while these initiatives are beginning to get their starts in different parts of the country, Connecticut is well advanced in each of these. Crisis intervention team training has been going on for a long time in Connecticut, and most police departments have at least one officer who's gone through that training, and most of the state police barracks have someone who's gone through the training. And more strikingly, DEMIS and Department of Children and Families began shifting over from police responses to DCF cases to social work, mobile crisis responses. And there's a very sophisticated, well-established system in Connecticut for dealing in that jurisdiction with those kind of cases. And as you've undoubtedly heard from Lisa Tepper-Gates and Annie Scully and their team, Connecticut's 211 system is substantially more sophisticated and developed than those in many other states. So this is the path we took that eventually led us to legislation which was developed on a bipartisan basis over the last 3 years at the federal level and corresponding regulatory action. And so our recommendation, having looked at this, what's called the 988 crisis hotline system, our recommendation that we sent up to the Connecticut State Bar Association was, one, that Connecticut implement the federally mandated 988 crisis intervention team hotline system. Two, that Connecticut enhance and expand behavioral health crisis response and suicide prevention services statewide. And three, that Connecticut fund the system through SAMHSA and DEMIS grants, reimbursements from private and public insurers, and funds raised by imposing a federally authorized excise tax on commercial mobile services or IP-enabled voice services. The federal legislation mandating the development of a uniform 988 National Suicide Prevention Lifeline reads like a behavioral crisis legislation. Its focus initially was a bipartisan concern about the suicide among armed service veterans. And that led to the notion that there should be a parallel 988 system, parallel to the 911 system, that had robust capacities of intervention with respect to suicide. But the language of the bill itself was not limited to this suicide prevention, and certainly not limited to veterans. And it was broad enough language that a number of states have realized that it presents a generational opportunity to reimagine police. Its subtitle might just as well have been the Let Police Be Police Act. Our problem is not behavior by the police, I don't think. Our problem is that as communities have repeatedly failed to provide adequate resources for addressing recurring crises in behavioral health, mental illness, substance abuse, homelessness, domestic violence, child neglect and abuse, we have asked our police to expand their services to address innumerable behavioral health emergencies well beyond their core vocation and training. There will always be in each of these areas some percentage of behavioral health emergencies to present a sufficient imminent threat of violence that a police presence will be necessary. But when we choose to send police as the default first responders in every case, we reflect not only a lack of nuanced judgment, but we engage in a default policy that inevitably results in multiple adverse consequences. These include, first, turning reflexively to law enforcement officers misuses and overextends our already thinly stretched police departments. Two, we deprive the individuals suffering behavioral crises of the professional mental health response that they need. Three, we cycle behavioral patients through repeated, costly, and ineffective emergency department admissions and discharges instead of referring them to the care resources that might break the cycle of substance abuse, homelessness, mental illness, et cetera, at a fraction of the course. Four, we end up unnecessarily routing a significant percentage of behavioral crisis sufferers into the criminal justice system with the multiplying expenses at every stage of the process, from arrest to adjudication to incarceration to include probation. And we dramatically increase, of course, the risk of police use of lethal force, particularly when the person is a subject is a person of color. In national data collection, the report out is that at least 23% of all fatal shootings by police officers in the line of duty since 2015 involved victims with known mental illnesses. In Connecticut, the data collection subcommittee of the Connecticut State Bar Association finds that in Connecticut, it's something of an ad hoc identification by police officers on the scene, but the estimation is that 40% of all fatal shootings by police officers in Connecticut in the line of duty involve victims with known mental illnesses. It is, for multiple reasons, aggravated with respect to people of color, as this quotation shows. The finding that Black men exhibiting signs of mental illness are also at higher risk of police killing than white men, particularly while unarmed, is indicative of a concerning pattern in policing. While white men with mental illness are more likely to be given treatment, Black men with similar behaviors are more likely to be criminalized for their actions. Research conducted over the past decade by the United States Department of Justice and other federal agencies has generated repeated recommendations for more nuanced responses to persons suffering behavioral crises. And you can see each of these referenced and cited and usually hyperlinked in our recommendation. These recommendations have been echoed by calls from many organizations such as the United States Conference of Mayors, the Leadership Conference on Civil and Human Rights, the National League of Cities and Arnold Ventures, and the Center for Police Equity for the adoption of mobile crisis unit, co-responder, and/or crisis intervention team alternatives to relying exclusively on law enforcement contain and control responses. As I pointed out before, Connecticut police departments and state agencies actually have taken a leadership position in experimenting or deploying each of these, often with this funding support from Connecticut's DEMAS. These are worthy and important initiatives, and we should certainly recommend a continuation of commitment, research, and development in each of these. Yet we've already experienced the financial and logistical challenges to scaling up these programs further. I think I could just incorporate by reference here the report we just had on the state-mandated feasibility studies. They read like a compendium of the limitations and obstacles to fully deploying these particular reforms in police departments in Connecticut. But this 988 hotline intersection has intersected with concerns underscored by the George Floyd murder to inspire a bipartisan national movement to implement the federal 988 mandate with statewide mobile crisis response committees staffed by professional healthcare workers. And here's the key to how states have found a creative way forward with respect to this legislation. The 988 legislation includes the express provision of authority to the states to impose and collect fees or charges, quote, applicable to a commercial mobile service or an IP-enabled voice service to fund, and this is key, quote, 988 related services if the fee or charge is held in sequestered accounts to be obligated or expended only in support of 988 services or, and this is equally critical, enhancements of such services. And subpart A makes ensuring the efficient and effective routing of calls made to 988 National Suicide Prevention and Mental Health Crisis Hotline to an appropriate crisis center. And B, and here's the key, personnel and the provision of acute mental health crisis outreach and stabilization services by directly responding to the 988 National Suicide Prevention and Mental Health Crisis Hotline. The states have kind of noted not only the requirement that they implement the 988 legislation, but this funding path as an opportunity to radically change the way in which they respond to behavioral crises. 3 states have already passed and signed 988 legislation into law: Washington, Virginia, and Utah. 3 states have passed 988 legislation: Alabama, Indiana, and Nevada. 12 states have introduced 988 legislation: Oregon, California, Colorado, Idaho, Kansas, Kentucky, etc. And new legislation is anticipated this summer or when the legislatures reconvene in 3 additional states. Our recommendation is 1, implement the federally mandated 988 crisis hotline system. That's hardly a challenging recommendation since it's required by the federal legislation. 2, take the path that has been taken by Washington and other states to use this legislation as a foundation for expanding and enhancing behavioral health crisis responses and suicide prevention services statewide, and fund the system through SAMHSA grants, DEMIS grants, reimbursements from private and public insurers, and funds raised by imposing a federally authorized excise tax on commercial mobile services or IP-enabled voice services. This is a recommendation to the General Assembly. And there is guidance. There's good guidance out there. I'm sure that Lisa and Annie and the 211 folks are more familiar than I am, as are some of you on the call. But there are some excellent guidelines for how to enact this 988 legislation in a robust and comprehensive way. And they include SAMHSA's National Guidelines for Behavioral Health Crisis Care Best Practices Toolkit, and a model bill that's been published by the National Association of Mental Health Program Directors. And these are the robust approaches taken in Washington and New York. I'm going to stop the share there, and the members of my subcommittee would be glad to take any questions that you have.
I'm sorry to interrupt. This is the interpreter. The interpreters are now going to switch. Would the spotlight controller be able to switch the spotlight to ASL interpreter Julie? Thank you.
Okay, thank you. Thank you, Mr. Masbeck, for that presentation. Are there any questions from the subcommittee at this point?
John, this is Lisa Tepper Bates.
Yes, of course.
Pitch in. I first want to thank Skip and Keith King both for their terrific work on this. But I do just want to call out, and Skip, you referred to this, but just for clarity, it's really important that the members of this subcommittee understand that the national picture is very different than the picture in Connecticut. So we welcome the increased focus on the idea of the crisis services through 988, but it's important that everyone here understands that 988 in Connecticut is an additional channel through which people will be able to reach the existing crisis services, which have been up and running for a while. So there's 988, there's 1-800-HOPE-135, 1-800-SUICIDE. People can call 211 and hit our crisis option. So 988 is welcome, but it is not actually introducing an entirely new benefit with regard to new crisis services. The important point, though, that I would want to stress is that that focus on the importance of having crisis services 24 hours a day and having a bandwidth for those crisis services adequate to receive the calls that we want to be coming to those crisis services and not going to 911. I think that that's a really important piece of this picture. So just wanted to sort of call out that nuance.
Well, appreciate that, Lisa. And I think that that's a distinction with an extremely significant difference. So thank you for bringing that up. One of the questions that I have is, and maybe I'm just naive, but I want to ask the question anyway to the folks that are here. There's a call for an excise tax in the legislation, and my question is there other federal funding, Medicaid funding, anything of that kind that already exists that might otherwise be bolstered or taken advantage of if it's not already here in the state of Connecticut, as opposed to implementing a new tax of some kind? I just feel like, in my mind, I feel like there's something missing there. That there's something that I'm missing. But it seems like an excise tax as opposed to, funding that is already out there for mental health that might be taken advantage of is something worth discussing if it exists and is out there. Can anyone that was involved in this work sort of speak to my questions?
Well, I'd like to defer to Lisa and Annie. They know far more about the funding streams than I do. But in the at the superficial level that has been the basis of our inquiry, and again, they know much more about this. There has been robust funding by SAMHSA to create the possibility of movement towards mobile crisis systems that create responses beyond police. That has I think mostly, if not exclusively, been channeled through DEMIS, which has made such funding available. And in the systems that DCF set up, and I think that Lisa set up, they are organized to try to capture such funding as is available from Medicaid, Medicare, and private insurance, where that can be tapped for the way the emergency is coded and the costs incurred. And just before I defer to Lisa, I think I learned, Lisa and Annie were very helpful. They know far more about, they've forgotten more about this than we've learned about it. But what I think I learned from them is we have one of the most sophisticated systems in the country in the 211 system and the DCF system, but they have an extreme finite boundary of their capacities because of the lack of funding for mobile crisis actual responses. And they're tapping, and I'm going to leave it to Lisa. I am going to shut up. The excise tax creates the possibility for them and others to have a robust source of funding that would create the ability to respond with mobile crisis units. Lisa, am I anywhere near the truth on this?
No, I think that was really helpful, Skip. But I think one of the questions that is sort of hanging out there that perhaps we can think about together is what are we trying to accomplish? What is the volume of calls that we think could be routed to this separate set of crisis services distinct from 911? And I'd suggest to you that we know what we know. And what we know is that we took 120,000 calls last year that were crisis calls. But I can't tell you how many other calls, in addition to the 120,000 that we took. And by the way, I think relevant for this discussion, of those 120,000 crisis calls, less than 1% actually required escalation to 911. And this tells us that separate crisis response works, right? And that's really good news, really important news, I think, from our learning in Connecticut. What we don't know, however, is how many calls were going to 911 systems across the state that we could, if we could build the awareness, first of all, of the alternative of calling either 988 or 211 or one of these 800 numbers, which filter to the same singular crisis team. How many calls are those? So this is a sort of multi-sided equation. How could we build better awareness across our state that there is an alternative to 911? Again, multiple alternatives, in fact, but let's just say 211, 988, what have you, right? How do we build that awareness? And then how do we think about what that volume of demand will be so that we can adequately resource? And I do want to give credit to our colleagues at DEMIS and at DCF, and very pleased to tell you that further to months of conversation, DEMIS has identified from multiple sources some additional funding. So we will be expanding the crisis team. So this is great news. But that doesn't answer the question of, well, what is that demand and how big should that crisis team be? So it would be very interesting to hear from others here. And Andrew and John, we had some conversation yesterday about the question of how do we size that piece of it? What percentage of the calls going to 911 today, if we could, would we reroute to these separate crisis services? And that's a really important part of the question here.
Chief Trum, if I could just sort of bring you into the conversation from the law enforcement side, is there any sense of what Ms. Tepper-Bates is talking about? Is any of that kind of data collected anywhere from dispatch centers in terms of of 911 calls that might not have needed to be 911 calls, just so that there can be this sort of synergistic, collaboration between the dispatches and 211 and further this kind of work.
First, I want to thank Skip and his colleagues for that presentation. You're spot on. And also, Lisa, you alluded to it. A very small percentage of, we respond to all of the requests that come in through 911, but a very small percentage require a police, I always say the guy with the gun or the guy with the gun coming to the scene. And some of those, it actually escalates it based on what they see coming to the door. So I think we're spot on here. It's a small percentage, and I think we're probably going to get there at some point. We talked to the difficulties earlier when Dr. Peterson did her presentation, her update. We're still finding our way in this, trying to accommodate. We're still answering the 911 calls as they come in, but we do have multiple officers that are trained in CIT training. So we're better equipped now than we were, let's say, 2 years ago, 3 years ago, and how we do the follow-up to these cases, or where we direct them when we arrive at the scene. So if it's hypothetically, if it involves something we have locally, maybe our youth and family services, school psychologists, other social worker within the town structure, then we're able to mitigate it almost immediately with contact with them. But they're not there at 2 a.m, when we're answering these calls. So that's something we're trying to accomplish, not an easy task. So to answer, I guess, the question greater, yes, it's a small percentage that really require a police intervention. We have the police resources doing a job they're not necessarily trained for, absent CIT training.
Thank you, Chief. And I just want to add something to what the Chief said when we were looking.
To comment when it's appropriate as well.
Of course. The one of the things that we looked at when we were looking at crisis centers and places that you could call, and we discussed this with Ms. Tepper Bates and Ms. Scully yesterday, is some of them are only open 8 to 4:30, as if you could schedule your crisis, right? Which is unrealistic. And so the availability needs to increase dramatically across the state, so that these services are available to people when they need them. So I just wanted to very quickly highlight that portion of our conversation as well. I will turn it over to Ms. Cheggy, and then I want to bring in. We've been joined by Ken Barone. I want to bring him in with respect to state data and 911 calls that may not have needed to be 911 calls. But yes, Mr. Cheggy, please.
Okay, thank you. Thank you, Skip and Lisa. I just want to expand a little bit about 988. So we're new to that, and we know about 211, but 988 is new. So I'm concerned about that it's not advertised very much, so if it's a little bit contradictory, that intervention, I'm not sure if the deaf and deafblind or hard of hearing are aware of that. We're sort of the last group to know what's happening and changes that are, especially concerning, especially when it comes to the point of needing a police. We need to have an interpreter ready. And especially when we call that communication access, for us, we have video phones, that's fine. But the point is, for those who have different understanding levels and communication, some of those levels are very low and they wouldn't be able to understand. So that's a concern for us here. Wow, 120 calls from last year. I'm wondering how many of those were from deafblind, and hard of hearing. Not in our private school for the deaf, but in the public in general. So I want to be able to help in those situations. So I'm curious to compare those percentages. So.
Would anyone care to comment on Mr. Cheggy's comments?
Just to respond, I'm afraid I can't break down the 120,000 right now. I don't have that data available, but I'd be glad to respond to Mr. Cheggy's question on that offline, and happy to share that with the rest of you. That's a fair question. I would just though reiterate, and it might be helpful. May I share my screen, John, Andrew? I'd just like to show one slide that I think is relevant here, because again, as much as we welcome 988, it does not represent a truly new service in Connecticut. It represents an additional channel to access existing service. And if I can just share one slide, I think it's helpful in explaining that. Hopefully, are you able to see my my slide screen?
Yes.
Yes.
Okay, great. So this is a slideshow, which again, we'd be glad to share with the entire group. But just important to acknowledge that 988 is an additional way that callers in crisis in Connecticut will be able to reach the existing 24-hour-a-day, 7-day-a-week crisis team. So, just want to make sure that we clarify that. The current 800 number crisis lines, the 211 crisis services option, 988 will all filter through to the same trained crisis team. So that's good news, right? That's actually a very good thing, because what we want is one centralized, very well-trained, well-certified team that is responding. So I hope that's helpful in answering that piece of Mr. Cheggy's concern. And I'll be glad to share these slides with you. If I may, John, can I take up just one more moment to talk about the 911, 211, Which When campaign, which is also covered here?
Of course.
Sorry to interrupt. This is the interpreter. Just before we keep going, can you switch the spotlight to the second interpreter? I don't think I'm visible. Thank you.
Great. So if I can continue just for a moment, and I'll be glad to share this, I do just want to flag the fact that as part of this whole discussion, we are really excited about our pilot campaign to build better awareness of the 211 option and the suite of services, including crisis services that are available there. We are starting in Stonington. I'm very grateful to Chief Darren Stewart, as well as the Community Foundation of Eastern Connecticut, who are our partners in this. And as you see here, we're going to push out through a number of channels, including lawn signs, billboards, social media, this rubric that you see here, 211 when it's helpful, and we spell out help, 911 when it's vital, right? And the idea there is to really help build that awareness of 211 and what we can offer. And as we said, an important piece of this, and I'll move to the next slide, is to reach people who are in crisis, whether that's a low level of anxiety or a much more severe state of crisis, including a risk of suicide, to know that, again, 24 hours a day and in a confidential way, they can reach our crisis team to provide some help. And our goal is going to be to expand throughout the state. One of the issues that I would flag is that we think it's really, really important that this effort to expand the campaign is entirely in concert with, in close partnership with our police leadership, which is on a community by community basis. So we'll be reaching out, including Chief Drum, to you in the course of time, in hopes of partnering with you to push out this important information. I'll take my screen down now, but I will be glad to share these slides with the group.
And Ms. Tepper-Bates, just for the purposes of transparency, I just want to again reiterate what we discussed yesterday and encourage 211 to consider options such as texting and other things to make their services more accessible to the deaf and hard of hearing community, as well as to those with disabilities that lead them to being nonverbal. Again, just to open up the accessibility of 211 as has been done with 911 now. And I just bring that up for a comment so that it's on record with this group as well, that we did discuss that yesterday.
No, that's exactly right, John, and I thank you for raising that. The resource constraints for some time have made it hard for us to move that direction, but I agree entirely with you that that's incredibly important. And in fact, as many of you know, the research coming out during COVID is showing that many people very much prefer to engage via text, to engage in some way, perhaps a little bit removed, when they are seeking that assistance or support during a mental health crisis. So that's something that we really want to engage more robustly around. I would flag also that we have very good cooperation with 711 and Connecticut Relay Services. So that is an additional channel. But that doesn't take the place for any reason of the texting capacity that we do hope to build, and that you're right to call out.
Thank you. Before we go to Ms. Knopf, I see your hand. I did want to bring in Mr. Barone very quickly to discuss, as we were mentioning earlier, 211 has data about calls that they have had to escalate to 911. And my understanding, Ken, is that you may have some information on 911 calls that may have not needed to be 911 calls.
Well, I think the goal is to try and figure out, right, there's a couple issues, but in order to assess the issues, and I think in order to assess the amount of resources that 211 would need, right, because it looks like 988, the crisis hotline, everything's being filtered to 211, right? That's non-police related. And what we're saying is that there's potentially some segment, and it's a potentially a large segment of calls that come into 911 that may have been better placed in the 988 or 211 system. And in order to assess the resources that are needed, it would be good to know, hey, if we really did a robust campaign and got people to use 988, 211 the same way they use 911, right? They think of 911, they call an emergency. In their mind, we've created a behavioral change where they know to call 988 or 211. I think there is a way to try and start to determine roughly what share of those 911 stops could potentially be redirected at some point if there was a better campaign going on to inform people about the new system. Oh, sure. We do it in our racial profiling work, where we will go in to a department and ask for their call logs. And so departments routinely keep call logs, and oftentimes calls into 911 are usually categorized. Now, the question is the level of detail that's captured in those call logs enough detail to be able to determine which of those calls may have been better directed towards 211? I'm not sure, but what I do think is worth exploring for this group is identifying maybe a few agencies and asking if they would be willing to share a 1 year, right there, 2019 or 2020 calls for service log. And from there, we can start to look at the data and figure out, is the data detailed enough for us to be able to get a general sense of which calls may have not needed to be made to 911. I think until we ask for the data, it's hard to determine. I've seen some of this data and worked with it before. I use it in a different context. So trying to answer the question you're trying to answer, I'd really have to go through and look at the data again to figure out if we can answer that question. But I think it's worth us picking a few departments, and I would suggest for those folks that are less familiar with how the back end policing stuff works, I would suggest picking agencies, a few agencies that use the next gen system. They're probably going to be, that's a records management system used by the majority of police departments here in Connecticut. And they tend to be the easiest to work with in terms of getting data out of the system to be able to look at this stuff. So if that's something that folks are interested in, I know Chief Drum uses next gen, so maybe we can start with his agency and see, you know, we can maybe build a template so that we can go to next gen and say, hey, we've worked with Madison and here's the data that we were able to pull out of their system, and can you replicate this for us in these 5 other departments? So maybe if the chief is open to that, it's something we can explore in the coming weeks.
I'd be happy to do that, Ken. I just want to add that in the town of Madison, we average probably, it's categorized as involuntary committal. That's using the hospital network. And we probably average 10 per month on a population basis of roughly 18, 19,000. Of course, the summer's higher. We do have some spikes during COVID. So, but I'd be happy to share that information and get involved with the project.
So again, I just think the point being, if we're trying to answer the question, which is if this 988-211 system were really to be moving and people used it the same way they use 911, what's the call volume they could expect? I'm not sure we'll get a perfect answer, but I do think there are ways to start to get a sense of what that call volume could look like if you were to start to see sort of full maturation of the system. And I'm happy to help with that.
And I would just add, if I could just add to that, Ken, I would think, but correct me if I'm wrong, you might not want to use the year of the pandemic, because that might be outlier type, unless you want.
We'd probably want to go to a department and do a 3-year look, say, so we might want 18, 19, and 20, right?
Sure,
and then we can see how 20 was impacted by the pandemic and other things. So yeah, I would agree with you though. We don't want to just look for 20.
Okay. Thank you. Ms. Knopf, I know you had a question. I wanted to turn it over to you.
I don't even know if I can remember what I wanted to talk about now.
I'm sorry.
That's okay. First of all, I think the 988 going to 211 and making it seamless is excellent, because the people on the back side of, or on the front side of it don't need to know that that's going to be happening. It's just going to go there. And you guys are a fabulous system already, so why try to recreate something that you don't need to do? It's like making another wheel. But I think it also, by creating a 988, you're going to get people's attention again about another way to do something. So I think that you may end up capturing a lot more of those calls and having them come to you than you would have had you said, you know, don't forget about 911, you know, we're here, we'll do this, because people already have their own concepts about what 211 is about. And then my last comment was, in doing your marketing, be careful about your colors. I know this is picky, but there are people who are colorblind. And when I looked at those signs, you have red on them, and then you have the orange and the red, and people with visual impairments may have problems with reading that. So you got to make sure you have good contrast, especially, you know, that looked like a lawn sign kind of thing. Well, no, your first slide wasn't, but, you know, if you're going to be doing it in a lawn slide, you know, sign, people are going to be going by and they're going to miss the point of the vital, you know, in the other words.
Thank you for those are really helpful comments. I appreciate it. And especially because again, what you saw is really a very small pilot. So we have substantial opportunity right now to take the input that you're providing and to think about that in the context of a wider campaign. And just also really want to thank Mr. Barone. Would really like to work with you on that. This is critically important information where we don't have anything to go on right now. So your help on that would be terrific. And whatever we can do as 211 to be helpful, we're ready to do it with you.
I have just a couple of questions, Lisa, for you. The first is, how long has Connecticut had 211? And can you talk about the increase over that period of time from where we started to where we are now? I think you said last year, 170 calls, 120, but can you just talk about the process of getting us to where we are now?
Sure. So 211 has been a service in Connecticut, an evolving service for more than 30 years. However, the specific mental health crisis services that we referred to, that's been something that we have been building a little bit at a time over many, many years as well. So the 120,000 calls I referred to in the course of 2020, that's our first actual full year of serving as the front door and the dispatch for mobile mental health crisis services in tandem with the Department of Mental Health and Addiction Services. So we don't really have anything to compare that to in specific. I would be glad, however, Pastor, to go back and look at the numbers that we've seen over time with regard to our work for many years as the core service for suicide prevention lifeline in the state of Connecticut, which is related to but a little separate from. And Annie can help keep me honest on that and make sure that we come back to you with those numbers as well. So it's a little bit complicated because, again, 2020 was our first year of this much expanded and more robust service for DEMAS and for DCF as that single front door. So we don't have a good standard to compare that to.
Okay, great. Thank you.
Okay, are there any other questions or comments for the folks from the CBA? Okay, if not, I'd like to thank all of you for coming today. We appreciate your time. We appreciate the recommendations. We will consider them and potentially vote on them for one of our future meetings. We normally talk about them at one meeting and then consider them in a future meeting, just so you understand a little bit about how our process works. But we thank you for being here, and we'll let you go unless you have any other final questions or comments for us.
Yeah, I don't think I came on a little late, so I apologize, but sure. I think it's been said that we want this committee to know, first of all, we value the great work of our police, and we believe that this will only enhance their ability to do their jobs and focus on the things that they should focus on. So if that wasn't said, I do want to make that clear, that we appreciate the good work of the police and certainly value your service.
Appreciate that, Mr. King. Thank you.
Very well. Have a good afternoon, everyone. Thanks for having us.
Thank you.
Thanks for having us.
Okay, so now we are going to move on to the next agenda item, which is the sequential intercept model recommendations. This is something that's been an ongoing discussion, and we were discussing it last month, but unfortunately, Dr. Peterson had some technical and hardware and software issues, and but she's back and better than ever today. So with that, I'll turn the floor over to Dr. Peterson.
And can we switch interpreters as well?
Oh, of course.
It may be easier if you just leave us both spotlighted and we will just turn our videos on and off, if that's something, if you don't want to have to keep switching it.
All right, it's all new to me. If you just give me a heads up ahead of time, I'll just replace it.
Will do.
All right, so barring any additional technical difficulties, hopefully my internet will not conk out. But yes, so in assisting this subcommittee, we've been using what's called the SIM, which is a sequential intercept model, which is essentially a template we are using to help answer the question, how do we improve police interactions with the disability community? And so the recommendations document that you may have read, that we've sent, is coming from that model. And we've been talking about SAMHSA, which is the Substance Abuse Mental Health Services Administration, which is housed within the Department of Health and Human Services at the federal level. And so this is where this template is coming from. It is a way to help answer the charge of this subcommittee. And so the recommendations document is coming from that. And so in doing this work, there are 4 sort of avenues to help answer this question. We've been looking at the feasibility of social workers in assisting police with crisis response. We've been looking at the voluntary registry system as another way. We've been looking at police education and training. So this is your crisis intervention training, or in some states it's called critical incident training. So your education of law enforcement and other emergency personnel responders. And then finally, school resource officers, which is an avenue of research that is ongoing. So we've been really focusing on 3 of the 4 at this time. And so the recommendations are mapping onto 3 of those 4 avenues of research. And so I don't know, Chair Slipka, do you want me to walk through the document, or I don't know if people have specific questions. I'm open to however you want to.
I mean, I think, Mr. Clark, I'd bring you in on this. I mean, I think for expedience, we don't necessarily need to walk through the document. Everyone's had it for several days, but these are the recommendations as they stand. We need to finalize our recommendations within the next few months to present to them, to the overall task force. And so that's why we're beginning these discussions now, so that we can fully bake anything that might need any further, further work. But these are the recommendations that have been established through all of our meetings and presentations up to this point. And so I think it makes sense for, at this point, if there's questions that people have, specific questions or comments on those recommendations, or any suggestions for further recommendations that we might entertain as well and consider, now would be the time to do that. What do you think, Mr. Clark? Am I?
That makes sense, and especially in light of the conversation today, which my sense would add to the document. And some of these involve the call lines, and after we sent them out, I know Ms. Tepper Bates recommended a little bit more specificity on some, which I think would be good. We don't have any necessarily proposed legislation, and I don't know if anybody on the subcommittee would have recommendations there, but they're more generalized in terms of education, awareness, and resources. But I think this to me is a working document that gets added to kind of with each conversation that we have. But certainly would be great to have folks on the subcommittee weigh in if we're missing anything, or if we've mischaracterized any conversations or the like. It'd be good to hear about that.
Right, and also, if you're good with the recommendations as they currently stand, then we may consider them for a vote at our next meeting. But we wanted to give you time to look at everything and digest the information, and come back with any reasonable comments or suggestions that you may have.
Well, and if I may, and I know this has already been stated, but the emphasis is on draft. This is a draft document.
Right.
It is a working document. And so in that spirit, we are absolutely open to input from this subcommittee. And and so that ought to be clear. Yes.
And just to add one more comment, I know in our private conversations we'd had some discussions about as we learn so much more in this arena with each subsequent conversation, it would seem that although the task force's charge ends at the end of this December, that there is value in ensuring that the work continues in some way, shape, or form. And I think just, for instance, with the social worker feasibility issue, you know, it seems that we've only really scratched the surface on that. And as departments implement different ways of doing that, either embedding social workers within departments or through the crisis intervention team model, it would be important to know how that's impacted, for instance, things like the 211 or 988 calls or the like. And so I think there's a general sense of the recommendations and the assistance with the interactions between the police and the disability community, but just putting them out there and not following up on that or identifying who could or should, I think would be a disservice to the community.
Thank you, Mr. Clark. I completely agree with that.
And if I may just add, before we leave to discussion, what is missing from the recommendations document is a focus on funding. And I know earlier we've been discussing funding mechanisms. And one question that I would like to see be pursued is to look at funding opportunities within the Department of Justice, specifically the Bureau of Justice Statistics and Bureau of Justice Assistance, which can be a source for funding opportunities regarding these topics. And so I know some deadlines have already passed, but they do circulate on an annual basis regarding identifying opportunities to assist with improving police interactions with specific communities. So that could be one arena we look at too.
Okay. All right, so with that, I open the floor up to any questions or comments on the current working document or recommendations. All right, seeing none, we will consider these recommendations as they are currently for the next meeting for a vote. If we want to make a motion to move those recommendations to the full task force, we can do that at our next meeting. In addition to that, if there are any recommendations that any of you have that are not here, if you don't want to bring them up now, or if you haven't thought of them now, that's fine. But certainly bring them to our attention, our being Andrew and Megan and myself, and we can consider them for future meetings for discussion and add them to our working document.
John, I would like to see if perhaps we could take a pass through the recommendations and maybe suggest just a little bit on the margins. In particular, I think we had such a good discussion just now with Ken Barone, and it would, I think, be really helpful to put into our recommendations the fact that we think there's a way to look at the data and then have a shared understanding of what is the volume of these calls, right? So I think there's a little bit that perhaps if you're open to it, if we could perhaps use the pen and do some track changes from our perspective, we'd be glad to circulate those back to the three of you this week. Is that possible?
I'm completely open to that if Mr. Clark and Dr. Peterson are.
Terrific.
Sounds good. You've got consensus. No problem. Thank you. Thank you for your willingness to do that. Appreciate it. Okay. So the next item on the agenda is other business. If there is other business at this point, I have none for the committee at this time. I think today was an excellent, robust discussion. I'd particularly like to thank the folks from the Connecticut Bar Association that joined us, as well as Ms. Tepper Bates and Ms. Scully from 211 to provide their perspective and context. I think that was extremely invaluable to give us really a 360 view, 360 degree view of the 988 concept and how it will play out here in Connecticut and all the great work that you're already doing. We're incredibly grateful for that. So does anyone have any other business that they'd like to discuss today? Okay, if not, the next meeting will be on August 31st at the same time. And with that, I will entertain a motion to adjourn. Not all at once.
Make a motion.
So moved.
Thank you, Chief. Is there a second? Mr. Cheggy, thank you for the second. Okay. All those in favor? All right. Thank you very much, everybody. Appreciate all of your input today.